Yes, I am a global Goodwill ambassador for the Young Leader Arts and Health Initiative. So very happy to join you in that capacity here this afternoon. I'm also a part of the WHO Youth Council. So a bit of the family there, Dr. Bailey. And we'll be having the conversation here today. I'm actually joining you from Switzerland as well. But I am Jamaican and I'm based in Jamaica and I'm an attorney at law and health activist in my country.
What are you doing in Switzerland?
I'm actually here meeting with some Swiss young people and some other young people from across Europe. We are discussing how we can, I guess, build more youth empowerment and youth engagement, particularly in this side of the world. So, really excited to have been here. And after this, I hope to see a little bit of Zurich. All right. So, Dr. Bailey, as introduced by Jenny, you have so many titles. And, as young people, we're so accustomed to meeting world leaders or hearing of them. But I think we'd love to hear from you at the heart, at your core. Who is Dr. Bailey?
I am the oldest youth leader of Arts and Health.
It's a good one.
No, I think at my heart, honestly, I'm a listener. Um, my greatest skill is to be attentive to what's going on around me and to respond authentically to it. And I think that's when I was a young man, I went to the American Academy of Dramatic Arts and trained to be a professional actor. And I learned something called the Meisner technique. And it was exactly that. It was saying that if you want to perform, and that can be on stage or that could be in life, it's not just about dredging up your emotions and portraying them. It's about paying attention to what's around you and authentically responding to it. And that's what can be mesmerizing on stage. And that's also what I think can be effective in life, and particularly in community work. I found that throughout my career, if I go into a community, it doesn't matter where it is around the world, and I come in with an idea that I want to impose because I think it's such a good one, chances are it's not going to go anywhere. But if I come in with an open mind and an open heart and listen and respond to what's actually there, then maybe something interesting is going to happen.
So I'm hearing thus far that in order for us to have authentic response and authentic experiences, we have to do a little bit more listening.
Yes.
And I think that's so
And
important. Go
yeah,
ahead.
and I think if there's anything that I've been trying to encourage, particularly within WHO, which is by definition a technical UN agency and therefore a collection of experts who are supposed to know the answers, is I try and encourage my colleagues, yes, by all means, use your expertise, but keep it in your back pocket and take it out after you actually understand what's happening on the ground.
Agreed. Agreed. Uh, you seem to have this appreciation for co-ownership, particularly with the groups that you work with, co-ownership by communities. And in doing some research, I saw where you'd bring a script to the community, half of a script. You'd only write half of it, and you'd have the patients or the health staff complete it. What lessons do you think we could learn from that experience and others that you may have in terms of having more co-ownership with young people and young professionals?
Well, first of all, I should say that I didn't create that technique. It's from a guy named Augusto Boal, who wrote a book called Theater of the Oppressed. And he created something called Forum Theater. And it was a way of engaging communities and activating them to make sure that what was created was something that they didn't just have a sense of ownership of, but they actually owned. And so using theater to do that, where they become not just participants, they become the co-author of the narrative of their community. And so that's where I got it. And I'm not the only one who uses it. UNDP uses it all the time. It's gone well beyond its original context around the world. but I also think, when I first presented this idea to Dr. Tedros, our Director General, a number of years ago, uh, he automatically jumped to the conclusion that this would be an internal project, that it would be about WHO staff practicing arts in some way. And I said, no, I imagine this as a full technical program, not just an internal activity. And he said, well, isn't it important that WHO change its culture first before we bring it out into the world? And I said, in my experience at WHO over 20 years, I've found, if I've learned anything, it's that it's much easier to change the world than it is to change WHO. And in fact, if you want to change WHO, you have to change the world first, and then WHO will follow. And that's what we've done.
I love that. You actually described this idea for the Illinois Initiative as a crazy idea.
Yeah.
That Dr. Tedros asked for some ideas, some crazy ideas, and you proposed this. Do you have any advice for us as young activists, young professionals in the space, in terms of how we introduce crazy ideas in a very hierarchical and I would say traditional sector of health?
Well, I think part of it is your goal isn't, as I just mentioned, to change the hierarchical organization. It is what it is. I think I've been somewhat, shall we say, uh, revolutionary in the background at WHO, proposing these sorts of ideas. But the goal was to uh, take advantage of the strong points of WHO, surf them, and apply them in the communities. And that's why I co-founded the Jameel Arts and Health Lab. That's why I co-founded the Open MRS electronic medical record system and any number of networks and groups. That's why I support Kunle's work because of his networked approach, the NeuroArts Blueprint, the One Nation One Project that Jill Sankey at University of Florida spearheaded for a number of years. It's all about supporting networks because the actual change is not going to be handed down from above from an organization like WHO or whomever else. The actual change begins and ends in the community. And the goal, the role for WHO is to be a convener, to provide evidence, to help make the case, to take that evidence and turn it into guidance for policy so it can be expanded to the most number of people and have it get paid for, um, and to amplify the success stories. But the actual change begins and ends in the community.
Understand. You mentioned the Jameel Arts and Health Lab. And for those of you who may not be familiar with it, it's a global initiative to measurably improve health and well-being through the arts. And they utilize a number of approaches such as pardon me, scientific evidence, artist-led advocacy, and capacity building. And I saw that you have a study on mental health on for young people coming out soon in October. I don't know if it's still too early or if we're jumping the gun a little bit here, Dr. Bailey, but do you have any early insights you could share with us here? Because I, for one, is very excited to see that report.
Well, I can't really share specific insights from the report yet. It's still in review and all of that. But what I can do is give some very concrete examples of some of the work that we do in mental health for young people. In my case, I work very often with groups that have experienced some form of conflict. So, just to give three very quick, rapid examples, I have worked with a group in Lviv, in Ukraine, of young people who have been forcibly displaced from their homes on the Eastern Front. And we're experiencing the visible signs of extreme trauma, hair loss, lack of sleep, dissociation. And on this particular day that I'm describing, it was at a community center in Lviv. The children were brought together, the young people were brought together, Ukrainian music was played, and the only instruction that was given was match your movement and speed to a person next to you. And that's it. There was no choreography, there was no instruction. And the result was this incredibly complex dance organically emerged as people began to pay attention to each other. And suddenly they began to laugh, and their expressions became brighter. And the mid to long term effects was all of those symptoms of trauma began to recede measurably. And it's one of many examples of how movement and connection and music and rhythm can literally help bridge, help reassociate from the dissociation of trauma. Another example is a Nigerian example. There's a woman named Oyinda who's on the list on this meeting right now, who joined me in Kaduna province. Behind me, this photo you see is the Emir's Palace in Kaduna in Nigeria. And a good friend of ours named Ochai Ogaba would have these weekly dance events where he would bring in Christian and Islam practicing young people and have a dance. And it wasn't just dancing together, it was choreographing a dance together, having everyone's story authentically being told, but then intermingled in joint movement. And the peace building of that was phenomenal. And then the last example is a theater group that I'm working with in Gaza, where young people who have lost their homes, who are moved every few days because of the next bombing, have experienced extended extreme trauma, use theater to maintain their sense of identity and hope. There was one young woman who was asked a question, what would you like in the future? And she said, if you asked me that a year ago, I would have said, in the future, I would like to be a doctor or an astronaut.
Mhm.
But today, I answer that question by saying, I would like to have a glass of water.
Mm.
Very powerful. And that gets us to, I think, the healing power of art for us. There's a quote from Carl Jung, the Swiss psychologist, who said, loneliness is not the absence of people. Loneliness is the inability to express what matters to you most. And if you can do that, then you have a bridge to reconnection, to a sense of belonging, to a support for your search for authentic meaning in your life. And that's the ultimate goal. That's what the arts can do.
Indeed, which is why it's so important for us to remember that health has to be comprehensive, right? It's a
Yeah.
complete social, emotional well-being, not just the physical aspect of it. And
Yeah,
that,
and you're absolutely right. And that's why I get a little worried when we talk too much about the arts as, quote, treatment, because that falls into this deficit model of
mm,
okay, we have these disabilities or conditions that we have to correct. That's part of it, but I think the real power of the arts is not just the absence of disease and infirmity, but attaining the highest level of physical, mental, and social well-being. And it's the asset-based approach that I'm most interested in. I mean, I'll give an example of a report that came out in February about how it was from Daisy Fancourt in the Frontiers in Medicine journal. Using a very large cohort analysis, she demonstrated how people who regularly practice the arts in some way um, have a much lower percentage of self-reported mental illness. And it went down from something like 35% of the population to 25%. Well, that's great, but I'm actually interested in that other 25% uh,
Agreed.
that have a chronic condition. How do you give them the tools to cope with that condition, to find meaning, to find productivity, to find a sense of community, regardless of what diagnosable condition they may or may not have? And that's where I think the power really resides.
Agreed. I hope we're all listening and taking ideas that may inspire us for additional work that we do in our communities. Um, Unfortunately, we're a little out of time, so I'm going to ask the final question. I know we've been having such a
A
great
final
conversation
question.
here.
Oh boy.
Yes. So you've toggled back and forth between arts and health. And in some interviews, you've described how every time you probably selected arts, you was something missing, and you selected health, you also felt something missing, and you came to that great mix of both. Do you have any advice for young professionals on the call before you go, Dr. Bailey, about how to maintain their varied interests as activists, as writers, poets, playwrights, dancers, etc.? How they maintain these varied interests along with their professional pursuits?
Well, I think the main thing about creative expression is that it's a way of living. And I think in modern society where we try to commodify everything, we make the mistake of thinking, oh, if I can't make money at it, then I shouldn't waste my time if I can't be professional at it. And that's not really the power of the arts when you get it right down to it. It's about um, being able to live fully in the moment, connecting with others. And if the way to do that is through visual representation or a movement through space or a sound or a story, it doesn't matter. Whatever winds your clock. A good meal, is a wonderful way of bringing community together. Um, so my advice to any professional, whether it's an arts and health professional or not, is live what you preach, practice it every day, and enjoy it fully and share it.
Enjoy it fully and share it. Those are the words from Dr. Bailey today, for our young leaders for Arsenal. Dr. Bailey, it was a pleasure having you here for a fireside chat. I know a lot of our young people in the chat, they want to hear more from you. So if you're comfortable, maybe there is a platform that you'd want to share with us in the chat. Or maybe we can share on your behalf, if you're comfortable, of course, that they may reach out to you on or just connect on other platforms. So once again, thank you, Dr. Bailey, and have the rest of a good afternoon.
So if you've got the fireside, I've got the chat.
Indeed, indeed. All right, over